regulates and improves uptake of receptor sites for many hormones. And that's probably one of the most important things that it does, and that's why it's so important to have in your body. Like we talked before, hormones are things that make things happen in your body. A couple of the ones that you may know of, thyroxine, it's the thyroid hormone, very important for many things like cell metabolism, controls like your weight, controls how energy is displaced. Serotonin, great one for like mental capacity. People that have low serotonin and low serotonin uptake levels in their brain tend to have like things like depression, and then a lot of other mental disease goes along with serotonin problems. That's why when you have those things, one of the big things they recommend, one of the big drugs out there are serotonin uptake drugs or serotonin uptake inhibitors if you're getting too much of it. Cortisol, stress hormone that's produced when you're stressed, causes your body to store fat. Vitamin D definitely has an effect on that. Insulin, another hormone in your body that causes your cells to take in sugar. So if you're diabetic, this is a big one for you guys. Vitamin D has a big role playing in helping insulin to work, helping insulin production, and helping the cells utilize insulin that you have. And then the other thing, as we go forward and talk about some heart disease, hormones are mostly made of cholesterol. You know, the body has cholesterol. When your body turns your body will turn the cholesterol into the hormones that your body needs. So vitamin D acts with cholesterol as well to help these hormones to function. And they're made from cholesterol. And if we're not producing the hormones that our body needs, or using them properly, or using them improperly, we're going to get an increase in cholesterol that your body definitely doesn't want. Some of the things associated with vitamin D that we're going to talk about here: obesity, thyroid disease, heart disease, osteoporosis, chronic fatigue, autoimmune disease, infections, and cancer. I mean, these are pretty much the plague of the 21st century, right here on this list. There's a chronic disease, vitamin D has something to do with it. It's funny, they all kind of tie together in a roundabout way. Let's start off with weight control. 75% or more Americans, again, probably deficient in vitamin D. Definitely not above 50 nanograms per milliliter that we talked about. And when they regulate people of being deficient, they're using the old standard. The old standard is if you're above 25, they say you're normal. We're saying that if you're at 25, you're nowhere close to it. Your regulation is not going to be where it needs to be. Vitamin D in conjunction with calcium and sunlight helps to properly assimilate food and regulate normal blood sugar levels. So this is going to have a role with diabetics as well. But when there's a lack of calcium, oftentimes due to vitamin D deficiency, the body will increase synthesis of, or increase production of synthase, which is the fatty acid enzyme that converts calories into fat. So if we don't have enough vitamin D, our bodies will actually take the calories that we're in and store instead of using them up and burning that fat. Calcium deficiency can cause synthase to be reduced up to 500% in its normal level. So it can really put on a lot of weight real quick. That's a good correlation between levels of vitamin D and obesity. Then thyroid disease. Hypothyroidism is probably the most, has the most issues with vitamin D, and that's when you have not enough thyroid hormone, or not enough thyroid function. Vitamin D actually helps to stimulate the thyroid to help the body produce normal amounts of thyroid hormone, mostly thyroxine. Vitamin D also helps in activation of thyroid hormone at the cellular receptor sites. So what the thyroid does is it produces thyroxine to help regulate metabolism throughout the body, and helps regulate metabolism in the cells. So cells have specific binding sites for thyroxine, which is a hormone, and if it doesn't also bind vitamin D at the same time, it doesn't work properly, and the cells won't want to bind it properly. So we see a problem with metabolism. And so what happens is the body will continue to produce thyroxine until it gets tired and it's not working, and it quits. It doesn't want working. That's usually what happens with hypothyroid. People become hyperthyroid, and then it'll crash and become hypothyroid. And then it just kind of stops working. What's the point? No one's listening. vitamin D has a big role in that because it's not getting uptaken at the cells, it's just sitting in the blood doing nothing. Heart disease, high cholesterol. When we're talking about heart disease, we're talking about high cholesterol, high blood pressure. You know, we already talked about obesity. Those are all like big risk factors with heart disease. Vitamin D has actually been shown to increase HDL, which is your good cholesterol. A lot of people, when they look at cholesterol, they look at your overall, your total cholesterol, which isn't necessarily the most important number. You want to look at your ratio of HDL to LDL. Normal amounts of vitamin D actually been shown to increase your amount of HDL, which gets your ratio back into a normal range, which is actually a better indicator of your risk of heart disease. You know, you could have, you know, your total cholesterol could be, you know, 500, which everyone's like, oh, that's terrible, that's really high. But if you have a good ratio of HDL to LDL, say, you know, if you have 250 LDL and 250 HDL, your ratio is way above normal. So it really doesn't matter then. So having proper amounts of vitamin D is going to help that. High blood pressure, shown to reduce blood pressure due to better thyroid function, better insulin function, and weight control. But you know, all the things that we see as a root cause with people, a lot of times with hypertension, are other issues that vitamin D assists. So as a whole, we can fix those issues, and sometimes it's as simple as having enough vitamin D. The blood pressure will go down and will function normally. Again, we talked before, hormones are made from cholesterol, and actually vitamin D, if you don't have enough, the vitamin D in your cholesterol in your body is looking to get turned into, or the cholesterol in your body is looking to get turned into vitamin D by the skin. You know, it's going to put that out there. You're going to have excess in your blood. Your body wants that extra vitamin D. If you have normal levels, the body won't be looking to produce more. And also, if you're properly using your hormones in your body, you use up some of that cholesterol that you should have been using to make some of those hormones. We'll talk a little later about the effect that vitamin D has on immunity as far as fighting off bacteria and viruses. Some heart disease can be linked with different bacteria or different viruses. Like if you've ever had rheumatic fever or scarlet fever, those two things predispose you to heart disease later because it actually attacks the valves in your heart. So if you've been on vitamin D since you're a kid, it's going to decrease your risk of ever getting those things because it's going to bolster your immunity so that it can decrease your risk of heart disease and that function as well. Another big risk factor is stress. Vitamin D helps keep cortisol in check, and without cortisol is the hormone that's produced in response to stress, and when we get that, it increases weight, increases fat storage, you know, all that stuff that's going to make heart disease more prevalent. So if we keep that kind of stuff in check, we're going to decrease your risk of heart disease in the long run. A big one, and this one they've known vitamin D has been a good source or a good control for a long time. Osteoporosis, osteomalacia. Osteoporosis tends to be older people. Bone demineralization. Osteomalacia, better known as rickets, tends to hit young people, bone development. And these two things can be controlled pretty much at relatively low levels, especially osteomalacia. And the way that they originally set up the standard for how much we should have in our diet, they set up, you know, the RDA values was set around preventing osteomalacia. So they only recommended enough vitamin D to prevent osteomalacia, which is actually on the spectrum of preventable diseases, these ones are the low man on the totem. The least amount of vitamin D will prevent these things from occurring. So vitamin D is important for absorption of calcium in the small intestine. Without vitamin D, our body will not absorb any of the calcium you take. You can take calcium all day long, your body won't absorb it unless you have vitamin D in your system. So don't go buy calcium unless you got enough vitamin D in your system. Just throwing your money out there. Vitamin D helps regulate calcium in the body. What happens if you don't have enough calcium in your body? Your body will actually take it to put in your blood because your body needs calcium to run things like muscle tissue, nerve tissue, a lot of other systems in your body kind of run on calcium or use calcium to run. So if you don't have enough of it,